practice as vein specialist at Royal Palm Square in Fort Myers, Florida. I'm a board-certified vascular surgeon with about 15 years experience as a vascular surgeon. And in June of 2006, I opened my practice in Fort Myers, and my practice is limited to the modern evaluation and treatment of venous disease. Up until 2000, our treatments of venous disease were fairly limited. They had either compression stockings, injection sclerotherapy, or vein stripping or ligation. So many patients were just kept in a corner, so to speak, because their leg problems weren't bad enough to justify a stripping. So basically they were relegated to the natural history of the disease. But since 2000, with the introduction of modern, minimally invasive techniques of endovenous closure, we're able to offer those patients something more than compression stockings, more effective than stripping, but much less invasive than the old stripping procedures. So what we offer at Vein Specialists is a patient-centered approach where we have compassionate professional staff members. Our practice is completely focused on lower extremity venous problems. So it's not just varicose veins, but it's venous insufficiency problems in general. And underneath that umbrella diagnosis of venous insufficiency are many different phases of venous insufficiency, such as diffuse spider veins with swollen achy legs with restless leg syndrome. There are patients that have varicose veins, but those aren't the only patients with venous insufficiency. There are patients who have been thought to be non-treatable, beyond the point of cure, who have skin discoloration around the ankle, who have had ulcers for years, but have never had an effective treatment of the underlying problem. So our goal is to identify the underlying problem with modern ultrasound technology, with a very professional and well-trained registered vascular technologist performing those studies, and then execute the appropriate procedures, often in combination with different veins being treated at one time, to render the best treatment possible. We've become the physician's vein specialists of choice in Southwest Florida. We take care of many physicians and their families, as well as thousands of their patients. I chose the name Vein Specialist at Royal Palm Square for two reasons. One, vein specialists is a plural word, and so it's not just me. I'm the vascular surgeon. I'm boarded in vascular surgery. I have a tremendous amount of experience treating arterial disease. And when I started performing endovenous closures in 2002, I noticed my vein practice growing very quickly. I was fortunate enough to have a colleague of mine who was a registered vascular technologist in the clinic up in Georgia make a move. They were ready to make a move. He and his wife joined me down here. Now JT Gerard, who's my registered vascular technologist for the past 3 years with me, has really grown with the practice. So when I refer to vein specialists, it's myself and JT who enables me to do the right things for patients. He's the guy that finds the pathology. I have some other specialists here as well, more or less patient specialists, whether it's the intake person, the checkout person, the caring medical assistants, or the nurses we have working with us, the billing specialists. All of my staff members or my colleagues are specialists in dealing with patients. They treat them as individuals. I strongly believe that physicians who limit their practices and really dedicate their practices to something within their area of specialty training obviously do the best job and have the patients with the highest satisfaction.